Bicknell Ramsey stood in his garage workshop, the familiar scent of sawdust and engine oil surrounding him like an old friend. At 74, this retired engineer had built a life of precision and purpose. His calloused hands, weathered by decades of fixing things that others deemed impossible, now trembled slightly as he examined the small wound on his foot that simply refused to heal. For 3 weeks, he'd watched this tiny breach in his skin grow larger, darker, more stubborn. It wasn't much, barely 2 centimeters. But for a man who had spent his career understanding systems and their failures, this felt ominous. Something was fundamentally wrong, and his engineering mind couldn't solve it with the usual tools. The morning sun filtered through his workshop windows as Bicknell made a decision that would save his life. He had volunteered for a clinical study on peripheral artery disease at UCSF Medical Center, and today he would mention this persistent wound to the research team. What he didn't know was that this simple act of seeking help would unveil a medical crisis so severe that 3 different surgical specialties would need to work in perfect harmony to keep him alive. Meanwhile, across the city at UCSF Medical Center, Dr. Kim was beginning his morning rounds. Known throughout the hospital as Dr. Miracle, his reputation preceded him in every corridor. His hands moved with supernatural speed and precision, earning whispers of admiration from nurses and residents alike. But beyond his technical brilliance lay something rarer, a heart that refused to accept defeat when human life hung in the balance. Today would test every ounce of his legendary skill and determination. Today, he would meet Bicknell Ramsey, a man whose body was silently failing in ways that would challenge the very limits of modern medicine. The small wound on Bicknell's foot was merely the tip of an iceberg. Beneath the surface lay a cardiovascular system so compromised that it would take nothing short of a miracle to save both his leg and his life. As Bicknell drove toward the hospital that morning, neither he nor Dr. Kim could imagine the extraordinary journey that awaited them. A journey that would prove that sometimes the most broken things can be made whole again through the power of medical innovation, human determination, and the refusal to give up hope. Are you ready to witness what happens when cutting-edge medicine meets unwavering compassion? Subscribe now and join us for this incredible true story of survival against impossible odds. Nurse practitioner Roberta Oka had seen thousands of patients over her distinguished career, but something about Bicknell Ramsey's demeanor caught her attention immediately. He sat in her office with the quiet dignity of a man accustomed to solving problems, yet today he seemed genuinely puzzled by his own body's rebellion. "It's been 3 weeks now," Bicknell explained, rolling up his pant leg to reveal the wound that had been haunting his thoughts. "In my line of work, I've always been able to fix things. But this," he gestured helplessly at his foot, "this just keeps getting worse." Roberta leaned forward, her experienced eyes taking in every detail. The wound was indeed concerning, larger than Bicknell had initially described, with edges that spoke of poor circulation and compromised healing. But what worried her more was the overall appearance of his foot and leg. The skin had a subtle pallor that whispered of inadequate blood flow. "Mr. Ramsey, I'm going to refer you to one of our vascular specialists," she said, her voice calm but urgent. "Dr. Michael Conti is the chief of vascular surgery here. If anyone can help figure this out, it's him." That afternoon, Dr. Conti examined Bicknell with the thoroughness of a detective solving a complex case. The ankle brachial index test revealed what he had suspected. Blood flow to Bicknell's legs was operating at only 30% of normal capacity. The diagnosis was clear: limb-threatening ischemia. But as Dr. Conti listened to Bicknell's complete medical history, a more alarming picture began to emerge. "Have you been experiencing any chest pain or shortness of breath?" Dr. Conti asked, his trained ear picking up on subtle clues in Bicknell's breathing pattern. Bicknell paused, considering. "Well, yes, actually. I thought it was just age catching up with me. Sometimes when I'm working in the garage, I get this tightness in my chest, and I find myself getting winded more easily than before." Dr. Conti's expression grew serious. Bicknell didn't fit the typical profile for severe cardiovascular disease. He wasn't diabetic, didn't smoke, and had maintained a reasonably active lifestyle. Yet every instinct in Dr. Conti's body was screaming that this patient was in far more danger than a simple wound would suggest. "Mr. Ramsey, I want to bring in a cardiologist to take a look at your heart. What we're seeing with your leg circulation might be connected to something bigger," Dr. Conti explained. "I'm going to call Dr. Yegiazarians from our cardiac catheterization lab." As the sun set over the hospital that evening, Bicknell found himself staring out the window of his hospital room, wondering how a simple wound had led to talk of heart problems. In his engineering career, he had learned that small failures often revealed much larger systemic issues. Now it seemed his own body was teaching him the same lesson in the most personal way possible. The next morning would bring answers that no one was prepared for. Answers that would require the most skilled medical team in the hospital to work together in perfect coordination to save not just Bicknell's leg, but his life itself. Dr. Yerim Yegiazarians had performed thousands of cardiac catheterizations throughout his career as co-director of the UCSF Adult Cardiac Catheterization Laboratory. He had seen hearts in every condition imaginable, from minor blockages to complete arterial shutdown. But as he prepared for Bicknell Ramsey's procedure, he had no idea he was about to witness one of the most severe cases of coronary artery disease he would ever encounter. The catheterization lab hummed with quiet efficiency as Bicknell was wheeled in. The retired engineer tried to maintain his characteristic calm, but his hands betrayed his anxiety, gripping the sides of the gurney as the medical team prepared him for the procedure that would reveal the true state of his cardiovascular system. "Just try to relax, Mr. Ramsey," Dr. Yegiazarian said, his voice carrying the reassuring confidence that had comforted thousands of patients. "We're going to get some pictures of your heart's blood vessels. You might feel a warm sensation when we inject the contrast, but it shouldn't be painful." As the contrast dye flowed through Bicknell's coronary arteries, the images appeared on the monitor with startling clarity. Dr. Yegiazarians found himself staring in disbelief at what he was seeing. The main arteries supplying blood to Bicknell's heart, the left anterior descending, the right coronary artery, and the circumflex, were all more than 90% blocked. The man lying on his table should have been having massive heart attacks, yet somehow he had been functioning with what could only be described as a cardiovascular system on the verge of complete collapse. "My God," whispered one of the catheter lab nurses, who had been assisting Dr. Yegiazarians for over a decade. She had seen severe blockages before, but never anything quite like this in a patient who was still walking and talking. Dr. Yegiazarians immediately turned his attention to Bicknell, who was watching the monitors with the intense focus of someone trying to understand a complex technical problem. "Mr. Ramsey, I need to be very direct with you. Your heart's main arteries are severely blocked, more than 90% in all the major vessels. The fact that you're here talking to me right now is remarkable." Bicknell processed this information with the analytical mind that had served him well throughout his engineering career. "So that explains the chest pain and shortness of breath. What does this mean for the wound on my leg?" "Everything is connected," Dr. Yegiazarians explained. "Your entire circulatory system is compromised. The poor healing in your leg and the blockages in your heart are symptoms of the same underlying problem: severe atherosclerosis. We need to act quickly." Within minutes, Dr. Yegiazarians was on the phone with Dr. Conti, sharing the devastating news. Both physicians knew they were facing a medical puzzle of extraordinary complexity. How do you save a man's leg when his heart is barely functioning? How do you perform the necessary cardiac surgery when the patient's circulation is so compromised? "We need to call in cardiothoracic surgery," Dr. Conti said, his voice reflecting the gravity of the situation. "This is going to require the best coordination we've ever achieved between our departments." As Dr. Yegiazarians immediately prescribed aggressive medical therapy, antiplatelet medications, cholesterol-lowering drugs, and beta blockers, he knew these were temporary measures. Bicknell needed surgical intervention, and he needed it fast. But the complexity of performing multiple major surgeries on a patient in such fragile condition would require a level of medical teamwork that would test everyone involved. That evening, as Bicknell called his family to explain the situation, his voice remained steady despite the overwhelming news. "They say I need heart surgery, maybe surgery on my leg too. But I'm in good hands here. These doctors, they know what they're doing." Little did he know that his case would soon bring together three of the hospital's most skilled surgeons in a desperate race against time to save both his heart and his leg. Dr. Scott Merrick, chief of adult cardiothoracic surgery at UCSF, had built his reputation on taking on the cases that others deemed too risky. When Dr. Conti and Dr. Yegiazarians called him about Bicknell Ramsey, he could hear the urgency in their voices. This wasn't just another complex case. This was a man whose life hung by the thinnest of threads. The three physicians gathered in the cardiac surgery conference room the next morning, Bicknell's images displayed on the large monitor dominating the wall. The room fell silent as they studied the extent of the damage. Dr. Merrick traced the blocked arteries with his finger, his expression growing more serious with each vessel he examined. "Gentlemen, this is one of the most challenging cases I've ever seen," Dr. Merrick said, his voice carrying the weight of 3 decades of surgical experience. "The coronary anatomy is not favorable for stenting. The blockages are too extensive, too calcified. If we're going to save this man, we're looking at a quadruple coronary artery bypass graft." Dr. Yegiazarians leaned forward. "But with his leg circulation compromised to this degree, can he survive a major cardiac surgery? That's the question, isn't it?" Dr. Merrick replied. "But here's what I know. If we don't address his heart first, he won't survive any surgery. His cardiac output is so low that any major procedure could trigger a massive heart attack." Dr. Conti nodded grimly. "And if we don't address his leg circulation soon, we'll be looking at amputation. The wound is getting larger every day." The 3 surgeons found themselves facing an impossible medical puzzle. Bicknell needed both surgeries to survive, but either surgery alone carried enormous risks given his condition. They were essentially asking his failing cardiovascular system to endure not one, but 2 major operations. "There's something else," Dr. Merrick continued, studying the detailed cardiac images. "Mr. Ramsey's vessels are in such poor condition that we may not have adequate veins for all the bypasses we need. We might have to use artificial grafts for some of the connections." The room fell silent again. Artificial grafts carried their own risks. They were more prone to clotting and had shorter lifespans than natural vessel grafts. But with Bicknell's anatomy, they might not have a choice. Later that afternoon, the 3 physicians sat down with Bicknell and his daughter Sarah, who had driven up from Los Angeles when she learned about her father's condition. The engineer listened intently as they explained the surgical plan, his analytical mind working through the risks and benefits. "So you're telling me that you need to rebuild my heart's plumbing system and then repair the circulation to my leg, and that both surgeries carry significant risks?" Bicknell summarized. "That's essentially correct, Mr. Ramsey," Dr. Merrick confirmed. "But I want you to know that we've never had 3 surgeons work this closely together on a case like this. We're going to coordinate every aspect of your care." Sarah reached for her father's hand. "Dad, what do you think?" Bicknell was quiet for a long moment, staring out the window at the city beyond. Finally, he turned back to the medical team. "In engineering, when you face an impossible problem, you break it down into manageable parts and tackle them one at a time with the best tools available. It sounds like you gentlemen are my best tools." Dr. Merrick smiled. "Mr. Ramsey, we're going to take excellent care of you. But I need you to understand, this won't be easy. The recovery will be long, and there will be complications we can't predict. Doctor, I've been an engineer for 50 years. I've never seen a complex system that couldn't be fixed with the right expertise and enough determination." The next morning would bring the first of 3 surgeries that would test the limits of medical science and human resilience. Operating Room 7 buzzed with controlled energy as Dr. Merrick's team prepared for what would become one of the most challenging cardiac surgeries of the year. Bicknell lay on the operating table, his chest prepped and draped, while monitors displayed the rhythmic patterns of a heart that was barely managing to keep him alive. Dr. Merrick stood at the scrub sink, methodically washing his hands while mentally rehearsing every aspect of the procedure ahead. He had performed thousands of bypass surgeries, but each patient brought unique challenges. With Bicknell, the challenge was extraordinary. How do you perform delicate surgery on a cardiovascular system that was already operating at the very edge of failure? "Dr. Merrick, we're ready when you are," called the chief surgical nurse, her voice carrying the calm confidence that had made her one of the most respected professionals in the cardiac surgery department. As Dr. Merrick made the first incision, he could see immediately that Bicknell's case would be even more complex than anticipated. The coronary arteries were heavily calcified, brittle, and in worse condition than the catheterization images had suggested. What should have been a straightforward quadruple bypass was quickly becoming an exercise in surgical improvisation. "The LAD is completely calcified," Dr. Merrick announced to his team, referring to the left anterior descending artery, often called the widowmaker because of its critical importance to heart function. "We're going to have difficulty creating a good anastomosis here." The surgical team worked with mechanical precision, each member understanding their role in the complex choreography of cardiac surgery. The perfusionist monitored the heart-lung machine that was keeping Bicknell alive while his heart was stopped. The anesthesiologist carefully balanced medications to keep him stable. The surgical assistants anticipated every move. But as Dr. Merrick began creating the bypass connections, he discovered that Bicknell's vessels were even more compromised than the imaging had revealed. The arteries were so damaged that only 2 of the planned 4 bypasses would be feasible. "We're going to modify the plan," Dr. Merrick announced calmly. "We'll bypass the 2 most critical arteries, the LAD and the right coronary. For the LAD, we'll need to use the artificial graft. His saphenous veins aren't adequate for all the connections we need." The decision to use an artificial graft carried additional risks, but Dr. Merrick knew it was their best option. As he carefully sutured the synthetic material to Bicknell's heart, his hands moved with the precision that had earned him his reputation as one of the finest cardiac surgeons on the West Coast. Hours passed in the operating room. Dr. Conti waited anxiously in the surgical lounge, knowing that his own complex leg bypass surgery would depend entirely on Bicknell surviving this cardiac procedure. Dr. Yegiazarians monitored from the cardiac catheterization lab, ready to intervene if post-surgical complications arose. Finally, after 6 grueling hours, Dr. Merrick stepped back from the operating table. The bypasses were complete, and Bicknell's heart was beating on its own again. The monitors showed improved cardiac output, and his blood pressure had stabilized. "He made it through," Dr. Merrick announced to his team, exhaustion evident in his voice. "But this is just the beginning. The next 48 hours will tell us if the bypasses are working effectively." In the recovery room, as Bicknell slowly awakened from anesthesia, his daughter Sarah sat beside his bed, tears streaming down her face. She had spent the longest 6 hours of her life in the family waiting room, alternately pacing and praying. "Dad," she whispered as his eyes fluttered open. Bicknell tried to speak, but the breathing tube prevented words. Instead, he squeezed her hand, a simple gesture that spoke volumes about his determination to survive this ordeal. But even as the cardiac surgery showed signs of success, Dr. Conti knew that the most challenging phase of Bicknell's treatment was still ahead. Saving his leg before infection and poor circulation claimed it forever. 3 days after his cardiac surgery, Bicknell's chest pain had dramatically improved, and his breathing was easier than it had been in months. The bypass grafts were functioning well, giving Dr. Conti the green light to proceed with the leg bypass surgery that could save Bicknell's limb from amputation. But as Dr. Conti examined Bicknell's legs in preparation for the vascular surgery, he discovered yet another complication that would test his surgical creativity. The wound on Bicknell's foot had continued to enlarge during his cardiac recovery, and more troubling still, the veins in his legs that would normally be used for bypass grafts were in terrible condition. "Mr. Ramsey, we have a problem," Dr. Conti explained during his morning visit. "The veins in your legs aren't suitable for creating the bypass we need to restore circulation to your foot. We're going to have to harvest veins from your arms instead." Bicknell nodded, his engineering mind already working through the implications. "So you'll take veins from my arms to bypass the blocked arteries in my legs?" "Exactly. It's more complex than our usual approach, but your arm veins are in much better condition. The procedure will take longer, and recovery will be more complicated since we'll be operating on both your arms and your leg, but it's our best option to save your limb." The following morning, Dr. Conti's team wheeled Bicknell into the vascular surgery suite. The room had a different energy than the cardiac operating room, quieter, more focused on the microscopic precision required for vascular reconstruction. Dr. Conti had performed thousands of bypass procedures, but using arm veins for leg circulation was among the most technically challenging procedures in his repertoire. "We'll start by harvesting the veins from both arms," Dr. Conti explained to his surgical team. "We need to be particularly careful to preserve the integrity of these vessels since they're our only option for creating a functional bypass." The surgery began with meticulous dissection of the veins from Bicknell's arms. Each vessel had to be carefully removed without damage, tested for leaks, and prepared for the delicate task of restoring circulation to his compromised leg. The process was painstaking, requiring hours of concentrated work under high magnification. As Dr. Conti began creating the bypass connections in Bicknell's leg, he could see the extent of arterial disease that had led to the non-healing wound. The arteries were narrowed to mere threads of their normal diameter, explaining why Bicknell's body had been unable to heal even the smallest injury. "Clamp off," Dr. Conti called out as he completed the final anastomosis, the surgical connection between the harvested arm vein and the artery below the blockage in Bicknell's leg. This moment would determine whether the bypass would restore life-saving circulation to his foot. The surgical team held its collective breath as Dr. Conti released the clamps, allowing blood to flow through the newly created pathway. Within seconds, they could see the change. Bicknell's foot, which had appeared pale and mottled for weeks, began to regain a healthier color as fresh blood reached tissues that had been slowly dying. "We have flow," Dr. Conti announced, unable to suppress a smile of satisfaction. "The bypass is patent, and we're getting good circulation to the foot." But as the surgical team celebrated this small victory, they knew that Bicknell's recovery would be far from simple. He now had surgical incisions on his chest, both arms, and his leg. His body would need to heal from 3 major procedures, while his newly reconstructed cardiovascular system adapted to its improved function. In the recovery room, as Bicknell awakened from his second major surgery in less than a week, he looked down at his bandaged arms and leg with characteristic pragmatism. "Well," he told Sarah, who was once again keeping vigil at his bedside, "they've certainly done a lot of replumbing work. Now we'll see if their engineering is as good as they claim." But their medical engineering would soon face an unexpected test that would require all 3 surgical teams to work together once more. For 2 weeks, Bicknell's recovery progressed better than anyone had dared hope. The wound on his foot was finally beginning to heal, showing healthy pink tissue for the first time in months. His energy levels were improving daily, and he was walking the hospital corridors with increasing confidence. Dr. Conti, Dr. Yegiazarians, and Dr. Merrick were cautiously optimistic that their complex surgical plan had succeeded. But on a Tuesday morning, as Bicknell was preparing for what he hoped would be his final day in the hospital, the familiar chest pain returned with a vengeance. "It feels just like before the surgery," Bicknell told the nurse who responded to his call button. "That same crushing feeling, like someone is sitting on my chest." Within minutes, Dr. Yegiazarians was at Bicknell's bedside, reviewing his EKG and blood work with growing concern. The cardiac enzymes were elevated, suggesting that his heart muscle was under stress. More troubling still, the EKG showed changes that indicated one of the bypass grafts might be failing. "We need to get him back to the cath lab immediately," Dr. Yegiazarians told the cardiac team. "Something's wrong with the bypass grafts." As Bicknell was rushed back to the cardiac catheterization laboratory, Sarah found herself once again in the terrifying position of watching her father's life hang in the balance. She had thought the worst was behind them, that the successful surgeries had given her father a new lease on life. Now, it seemed, they were back where they started. The catheterization revealed Dr. Yegiazarian's worst fears. The artificial graft that Dr. Merrick had used to bypass the left anterior descending artery had completely shut down, blocked by clots that had formed despite the blood-thinning medications Bicknell was taking. "This is exactly what we were worried about with the artificial graft," Dr. Yegiazarians explained to Dr. Merrick, who had rushed to the cath lab as soon as he heard about the complications. "The synthetic material is more prone to clotting than natural vessel grafts." Dr. Merrick studied the images with the analytical intensity that had made him one of the most respected cardiac surgeons in the country. "He's not a candidate for another bypass surgery. His chest has too much scar tissue from the first procedure, and his overall condition is still too fragile." "Then we go with Plan B," Dr. Yegiazarian said decisively. "We'll use stents to open up the arteries on the left side of his heart. It's not ideal given how calcified his vessels are, but it's our best option." The decision to use coronary stents in arteries as severely diseased as Bicknell's was risky. The calcified plaques could prevent the stents from expanding properly, or worse, the procedure could cause the arteries to rupture. But with the artificial bypass graft completely blocked, they had no choice. "Mr. Ramsey," Dr. Yegiazarians explained as the team prepared for the stenting procedure, "we need to place some small metal mesh tubes in your heart arteries to keep them open. It's a less invasive procedure than another surgery, but given the condition of your arteries, it carries significant risks." Bicknell nodded, his face pale but determined. "Doctor, you've kept me alive this long. I trust your judgment." The stenting procedure required every bit of Dr. Yegiazarian's considerable skill. The arteries were so calcified that special high-pressure balloons were needed to expand the stents. Each placement was a delicate balance between opening the blocked vessel and avoiding catastrophic rupture. One by one, Dr. Yegiazarian successfully placed stents in the arteries on the left side of Bicknell's heart. As the final stent expanded into place, blood flow to the previously starved heart muscle was restored. The chest pain that had terrified Bicknell that morning began to subside. "We got them all," Dr. Yegiazarians announced to the catheter lab team. "All the left-sided arteries are open and flowing well." But even with this success, all three physicians knew that Bicknell's case would require unprecedented long-term collaboration to ensure his continued recovery. Over the following year, Bicknell's care became a testament to the power of coordinated medicine. Dr. Conti, Dr. Yegiazarians, and Dr. Merrick worked together more closely than they had ever collaborated with any patient, sharing every detail of his progress and coordinating every aspect of his treatment. Dr. Yegiazarians saw Bicknell monthly, carefully monitoring the stents and adjusting his medications to prevent further clotting. The combination of antiplatelet drugs, cholesterol medications, and blood pressure control required constant fine-tuning as Bicknell's body adapted to its new cardiovascular configuration. Dr. Conti followed the leg bypass just as carefully. 6 months after the surgery, some scar tissue had formed around the graft site, reducing blood flow to Bicknell's foot. In a minor revision procedure, Dr. Conti successfully cleared the scar tissue, restoring full circulation to the limb they had fought so hard to save. Meanwhile, Dr. Merrick continued to monitor Bicknell's overall cardiac function, watching for any signs that the remaining bypass graft might be failing or that other arteries might be developing new blockages. But perhaps most remarkably, Bicknell himself became an active participant in his own recovery. The engineer who had once solved complex mechanical problems now applied the same analytical approach to understanding his medical condition. He meticulously tracked his medications, monitored his symptoms, and followed every recommendation from his medical team with the precision he had once applied to his professional work. "You know," Bicknell told Dr. Conti during one of his follow-up visits, "in my engineering career, I learned that the most elegant solutions often come from teams working together on problems that seem impossible to solve alone. You three doctors have proven that principle in medicine." The wound that had started this medical odyssey healed completely, leaving only a small scar as evidence of how close Bicknell had come to losing his leg. His energy levels returned to near normal, and he was once again spending hours in his workshop, building furniture for his grandchildren and tinkering with mechanical projects that gave him joy. Dr. Yegiazarians often reflected on Bicknell's case during medical conferences where he presented their collaborative approach. This patient required procedures from 3 different surgical specialties performed in perfect coordination, with ongoing management that challenged every aspect of our medical knowledge. But the result is a man who not only survived but thrived. 1 year after his initial presentation with a small wound on his foot, Bicknell returned to the hospital not as a patient, but as a volunteer, sharing his story with other patients facing similar medical challenges. His message was simple but powerful. Never give up hope, trust in your medical team, and remember that even the most complex medical problems can be solved when the right people work together with determination and skill. Today, more than 18 months after that first visit to nurse practitioner Roberta Oka, Bicknell continues to defy the odds, living proof that modern medicine can achieve miracles when expertise, technology, and human compassion combine in perfect harmony. Today, Bicknell Ramsey walks through his neighborhood each morning, his stride confident and strong. The wound that nearly cost him his leg has healed completely, leaving only a faint scar and an incredible story of medical triumph. His heart, once 90% blocked and barely sustaining life, now pumps with renewed vigor thanks to the coordinated efforts of 3 exceptional surgeons. Dr. Conti, Dr. Yegiazarians, and Dr. Merrick continue to collaborate on complex cases, but they often reference Bicknell's case as the gold standard for multidisciplinary medical care. Their success didn't come from any single procedure or breakthrough. It came from their refusal to accept defeat and their commitment to working together as a unified team. The lesson from Bicknell's story transcends medicine. When facing seemingly impossible challenges, whether in health, work, or life, the power of expertise combined with determination can overcome even the most daunting obstacles. Sometimes the difference between failure and success lies not in avoiding risk, but in carefully calculated courage and the willingness to trust in skilled professionals who refuse to give up. For anyone facing a serious medical diagnosis, Remember that Bicknell's journey began with a simple act of speaking up about a small concern. That tiny wound on his foot was his body's way of revealing a much larger problem. One that, when properly addressed, led not to limitation but to renewed life. If you're dealing with health challenges, be your own advocate. Ask questions, seek second opinions, and never hesitate to voice your concerns to medical professionals. Your body knows when something isn't right, and sometimes the smallest symptoms can be the key to solving much larger problems. Take a moment today to appreciate the incredible advances in modern medicine and the dedicated professionals who work tirelessly to heal and restore. Share this story with someone who might need hope, and remember that sometimes the most broken things can indeed be made whole again. Bicknell Ramsey's heart may have been 90% blocked, but his spirit was 100% determined to live. In the end, that combination of medical excellence and human resilience proved unstoppable.